River Shalom Hospital in Machakos County has been closed following reports of 7 confirmed COVID-19 cases in the hospital. This is as the number of coronavirus cases in the country rises to 5,811 after 278 more people tested positive in the last 24 hours. Zainab Mohammed with the details.
On Saturday morning, patients and staff of Athi River Shalom Hospital in Machakos County found themselves at a confused state after the hospital was closed down on Friday night following the contraction of COVID-19 by 6 patients and 1 health worker. According to Thomas Ndolo, an administrator at the hospital, the frustrated staff arrived at the hospital to release the night shift staff as is their usual routine, only to be blocked from accessing the hospital.
Our hospital was closed at 9:30 p.m. and it is so unfortunate that every responsible person in management had left the facility. And I was notified and I came back, only to realize that I cannot enter, nobody can enter, nobody can get out. Now, I even asked the Askaris, now what do you mean? Because we have doctors on call. Yeah, what we have obstructed labor, what we have emergencies, what do we do? So I told that that's the order that has been given, and I was very, very mad.
The hospital that is reported to have about 180 staff and patients currently locked inside is being blamed for not providing adequate information to the government on its COVID-19 status, an accusation vehemently denied by the hospital staff.
The last 2 weeks, we have been experiencing increase in patients who are suspected cases. We usually follow the protocol. When we suspect them from our fever clinic, we usually report to the county through the sub-county and then give names, location, age, and all the biodata. Then we test. If they have no keys, we procure ours and we test. And then we wait for the results. The results are done at level 5 and they pass through the sub-county and they have a copy for every test that have been done here. Now, if tests turn positive, it's not our mistake. It should not be taken like it's our mistake.
4 deaths related to COVID-19 have also been reported from the hospital, as the government says it's necessary for all hospitals to be fully prepared to treat COVID-19 cases so as to avoid cross-infections in health facilities.
Indeed, what we are noticing is that in this particular case, there was cross-infection. And our teams are currently on the ground as we speak, teams from the Ministry of Health collaborating with county government teams to ensure that measures are put in place.
The government further says new health workers will be deployed to Athi River Shalom Hospital with adequate PPEs in order to relieve the currently overburdened health workers quarantined in the facility.
Healthcare workers who are there, we are trying to ensure that they are rotated because they cannot continue working. And we are working on a modality where fresh group of staff can go in with the proper fitting of PPE, and we have made sure that the adequate PPE has been available at the hospital.
For TV 47, I'm Zainab Mohammed.